Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jahangir Wellness Center. My name is Kavas Jahangir, here from the JWC studio. I've got a very, very special guest today. Today, I've got one of the leading doctors here of urology here in Pune and the region. I've got Dr. Deepak Kirpekar.
Thank you.
Thank you so much for being here, Doc. You've got a long list of accolades and experience. The number one that pops out to me is that you've done over 25,000 surgeries. That is
You're right.
quite something. So thank you so much for being here. It's an honor to finally have you here.
Thank you. Thank you very much. This is an honor and a wonderful opportunity for me to be here today.
Absolutely. And I mean, we've got many things that we can get into, but the first question that I love asking some of our guests is, what does wellness mean to you, Doc?
Wellness clearly means to me that you need to discipline yourself
Okay.
and follow the regular norms.
Right.
That's what will keep you. That includes you need to change your diet, you must have physical activities, you must have control on your weight, you must have control on substances that you consume like
Right.
tobacco. There are multiple things.
Yeah, there's so many.
According to me, everything is okay, provided it's in moderation.
Okay.
And that keeps you going.
Balance.
Yeah.
Right. Well, coming then to your field of expertise, urology, in a quick few words, what is it?
Well, if I have to really narrate what I have experienced in the last 50 years, I can go on for hours. But to be very precise, I joined medical school in 67
Okay.
and I'm with urology since 75. That's 50 years. In the 70s and mid 80s, it was only open surgery
Okay.
for everything.
Right. You mean you cut open someone with a knife,
That
effectively?
was it, up until mid 80s.
Yeah.
Mid 80s, we started getting endoscopes. That means we were able to look within without cutting. But that was not good enough. We wanted to do something inside.
Okay.
Then we had energies coming in. We used ultrasound.
Right.
We used pneumatic for stones.
Oh, wow. Okay.
We use electrocauteries underwater. And now, latest, we are using lasers.
Okay.
So these are all evolved things over a period of time.
Right.
And today, what earlier was said, I shall not cut for a stone, it's coming true. We hardly cut anybody for a stone.
Yeah.
There are a number of ways we can do it.
Yeah.
As far as the patient's part is concerned, they are aware because of internet explosion and
Absolutely.
social media. So they come early for the treatment part of it, which is
That's
good.
good. Yeah.
But at the same time, the information they gather is not necessarily all
Right.
true. And so there is a lot of confusion involved in it. And in Jahangir, we have all the modalities available to do with this.
Right.
Last thing that is coming up very rapidly is a robot.
Okay.
And at this point of time, I would like to let the audience know, when I say laser, people believe it's something done from outside,
Yeah. That's what I think when you say it now.
which is totally wrong.
Okay.
For a laser to be applied, we need to use an endoscope and we use a laser fiber so as to reach the target. So it's an invasive procedure. It's not a non-invasive procedure.
Yeah. Okay.
Second thing is when everybody talks about robot,
Yeah.
people believe the robot operates. No, robot doesn't operate. It's just a machine. It's the skilled surgeon behind the robot who has the skill to operate a robot. So it's just a machine. Man behind the machine matters a lot.
You're still in the driver's seat.
Yes, that's right.
Okay.
So people often have this misconcept of a robot, what it does, and as far as laser is concerned, what it is.
It's glad that you clarified the differences and the intricacies of both of that.
Yeah.
But you were talking about things like stones and early detection. So coming back to that aspect, what are the most common things that people come to you with? Is it stones? Is it urinary tract infections? Or what is the most common one? And then we can talk about early detection and dealing with that.
I think I would say there are certain symptoms which should never be ignored.
Okay.
And one of them is hematuria.
Okay.
Hematuria is passing blood in the urine.
Right. Yeah.
It can happen due to a very simple thing like infection. It can happen due to a small stone trying to come down. But remember, hematuria also is a first sign of a cancer in the system.
I see.
It could be prostate,
Of any kind, is it?
bladder, or kidney.
Okay.
And so we always tell, if you see blood in the urine,
Right.
you must seek a help and investigate further.
Hmm.
The second common symptom that people talk about is a pain. If you have pain while passing urine,
Right.
it's infection. Nothing to worry about.
Okay.
But a typical pain in urology is a pain starting in the flank, radiating forward,
Okay.
associated with nausea. This is a very typical pain due to stone.
To stones. Okay. Yeah.
Body is telling you with the pain that you need to do something. I wish cancer patients have pain earlier, we can detect them.
Of course.
Pain appears in cancer much late. And
Yeah.
that's why we see cancer at a later stage.
Interesting.
So pain is a second important factor that you must not
Ignore.
ignore. And then we have multiple symptoms like a frequency, urgency, difficulty in passing urine, which apply to both men and women.
Right.
They also need to be taken care of, because not necessarily we need surgery for that. We can treat them and improve a quality of life.
Of course.
At the end of it, what is it? It's a quality of life that
Right.
you're looking after, nothing else. So these 4-5 symptoms are very important, and if you have any one of these, you should seek help.
Okay. Yeah, that's actually very informative. Something as simple as just pain.
Pain.
Right. And so these are the early detection signs that people should be looking at if they have this kind of thing. Right. But what are things that causes things like stones and
If you really look at the prevalence of stones,
yeah.
all over the world, if it's say 12%, certain states in India
Right.
may probably go to 14%. So if you talk about 14% and 10%, it doesn't sound
High, yeah.
high. But if you look at India's population is 140 crores today, 10% of that is
It's a lot.
a lot.
Yeah.
If you look at the world population of 850 crores, 10% of that is 80 crores.
Right,
So
right.
it is an important thing. The primary cause of stone formation is dehydration.
Okay.
People often relate it to the food they consume. Somebody will say, don't eat strawberry, don't eat this with that. No, the primary cause of formation of a stone is a dehydration.
Okay.
Just to give an example, in
Yeah.
that glass in front of you, if I put 2 spoons of sugar,
Yeah.
it will dissolve. I don't see it.
Yeah.
If I put 10 spoons of sugar, no matter how much I stir,
It's gone.
it's super saturated and crystals will remain. This is what happens in human body.
Ah, okay.
You keep on passing crystals whether you like it or you don't like it. So if you have a good hydration, they go in the resolve form
And they
and
go.
never form crystals.
Okay.
Where you work is important. If somebody is working in an air-conditioned office, traveling in an air-conditioned car, his requirement may be 1.5 liter a day.
That's
But
low. I mean, most people always say 3 liters or whatever.
But those who are working on the streets
Okay.
in daylight, bright sun,
More physical activity.
that's right. It all depends upon what your activity is.
Right.
But you should be able to produce about 1200 ml of urine a day.
1200 ml of urine a day. Okay.
That means about 1800 cc intake is necessary.
I see. Okay.
Second important cause for stone formation is dietary, only if it is uric acid stone.
I see.
Common stones are calcium oxalate, calcium phosphates.
Okay.
They are the commonest.
Right.
They are related to dehydration. Food habits have nothing to do with it. Uric acid is the end product of protein metabolism. And so, if you have high uric acid, you must stop protein intake.
Oh,
particularly,
Stop the intake. Oh, wow.
particularly the red meat part of it.
Okay.
Fish and chicken is allowed.
Right.
Uric acid levels either go to form stones, which are seen in the urinary tract, or they get deposited in the small joints in the body and have gout.
Okay.
So uric acid is somewhere you have to control your eating habits.
I see.
Otherwise, no other stone is responsible for food directly.
Right. Okay. What about having beer to get rid of stones?
Everybody says, I have a stone pain, can I have a beer? My argument for that is no. Beer actually is high in oxalate, and post beer you have dehydration.
Ah.
If I ask somebody to drink a beer, he gets a 750 ml bottle
Yeah.
and drinks to the last drop. But if I say drink 750 ml water, he will leave 100, 200 behind. So effect of 750 ml of water is better than 750 ml of beer.
Okay. But I guess the underlying premise of that is that exactly what you're saying is hydration. So is that something that you would say is the number one tip that you would give for really anything that's related to your field would be just stay hydrated,
I would say definitely.
regardless of whether it's stones, infection, cancer. I don't know.
If you talk about the lifestyle factors, hydration is the second factor.
Okay.
After diet comes hydration.
Right. In fact, I was going to ask you the next question. But like, what are the biggest things that you're seeing today in lifestyle changes, particularly in India, is that affecting that more and more disease, perhaps? Or, what are the things that you're seeing that are affecting that and how we can correct it?
The disease pattern is definitely related to lifestyle. 100%. Just to give an example, prostate cancer
Yeah.
is a fearful disease. This is the third common cancer as far as the males are concerned. If you ask me to tell you the percentage, in United States, the incidence is 110 patients per 100,000 population.
Okay.
That used to be about 8 patients per 100,000 population in India 20 years ago.
Wow. That's a big difference.
Now we have come to 18 to 20 per 100,000. So we have doubled
Yeah.
the number.
Yeah.
And we often feel nothing else has changed except the lifestyle. So these could be related indirectly to the lifestyle that the modern people are acquiring, which would involve eating high fat contained foods,
Yeah.
ready-made foods. A lot will depend on the food.
Okay. Well,
Takeaways.
yeah, there are lots of takeaways, but before we get to takeaways, Dr. Kirpekar, I'd ask you, you've got so much wealth of experience and you've been dealing with so many patients. What is the kind of things that you adapt in your own lifestyle, given all that you see?
Regular checkup.
Okay.
I think beyond 50, everybody must do a regular checkup
Absolutely. How often you do yours?
once a year.
Good.
That's a must.
Yeah.
Particularly for men, you must check your PSA values.
And that is for what?
Prostate cancer.
Prostate cancer.
Prostate cancer has a hereditary connection.
I see.
So we say if your father had a prostate cancer, you should start checking after 50. If nobody in your family has ever had a prostate cancer, but still you should start checking at 60 onwards.
Okay.
This is a very simple blood test and a marker to decide how further you go as far as investigations are concerned.
Right.
That's number one. Number two, I think one has to keep a control on the sugar part of it.
Okay.
Number two, you have to monitor your sugar intake and your sugar blood levels.
Right.
Important. There is no need to go to a doctor if you find a little higher sugar level. You can start exercising.
Absolutely.
If you are a diabetic and you are taking X amount of medication and you start doing regular exercises, your medication drops to half.
Yeah, absolutely. That is the power of exercise.
That's right. So keeping fit and active. I, for example, don't use lift anywhere.
Oh, yeah, that's a very good piece of advice, actually.
Even in Jahangir, I will not use lift.
Yeah, me too.
I will climb up 6 stories and then descend down looking at my patients. Just keeps me going well.
That is a very good tip, because that's exercise without people having to think about it.
Yeah. Walk a lot.
Yeah.
Drink a lot. Control. Of course. Control your food.
Right.
In the right manner.
Right.
Lots of antioxidants you must have. Lots of vegetables that you must have. Fruits you must have.
What do you do for your stress?
I didn't expect that question. But what do I do for my stress?
Yeah.
I recite Ram Raksha in my own mind.
Okay.
Whenever I get time.
Yeah.
That keeps my mind cool.
Okay.
Not to an extent. If I'm doing a transplant also, which I do twice in a week, I would still recite the Ram Raksha before I go. Keeps the mind cool.
Yeah, that again is such a powerful thing.
It's just a way of disengaging other thoughts from your
Right,
mind
right.
and concentrating on what you are supposed to do.
Focus in.
So that's the way to take care of the stress as far as I'm concerned.
No, that's good to know.
One more thing.
Please.
If I'm under stress, if I've done 10 cases in a day, I think I'll go for a drive.
Okay.
I love
know
cars.
you're a car enthusiast.
Yes, so I'm a car enthusiast. So it's so often that I've worked entire day. In the evening, I'll just put my music on and drive for some time.
That doesn't give you more stress in Pune traffic right now?
Get out of Pune.
Okay.
Get out of Pune.
So nice drives outside.
That mix. Music.
And you can do that while you're driving?
Yeah, we can do that while you're driving.
Lovely.
Phone is off.
Good. Well, Doc, it's been fascinating hearing all your insights and key takeaways. So I think the number one thing this seems to be for me is hydration can cure so much or prevent
Yes.
so much if we had to just put it all in one bottle, so to speak.
Since we are here,
Yeah.
for all the men who are listening, I think we should talk about prostate also.
Yeah,
Because
please.
that
Let's,
is the commonest thing that men suffer from and fear of,
Yeah.
a prostate enlargement. Let's take the statistics. Anybody above age of 60
Okay.
will start developing a hyperplasia in the prostate. It's a physiological change that happens due to hormonal declines.
Just like a natural enlargement.
It's a natural enlargement.
Okay.
And it happens to everybody. But that does not mean everybody needs a treatment. The treatment part is required only if you start retaining urine behind.
Okay.
Your prostate may be 100 grams, normal weight being 25.
Okay.
But as long as you are voiding well,
Okay.
there is not much of an issue at all. You don't need anything.
I see.
But if you are not voiding well, keeping urine behind, then you are likely for infection, then you are likely for kidney changes,
Okay.
and that has to be taken care of.
Yeah.
In 70s, when I started, 80s when I started, open surgery was the only option available.
You were saying.
But now we have multiple options available. In 80s, medicines came in for prostate, which have
Yeah.
done extremely good.
Right.
Though they are expensive, and one has to decide how far do you give them, but medicines help. Beyond medicines, there are a number of minimally invasive procedures which are now available, which are good, which will prevent symptoms, and which will give a good quality of life. I don't understand why anybody 70 should get a 5 times at night and spoil the sleep.
Yeah, absolutely.
In being wellness, sleep is also a very important factor. If you sleep well, you have different, your wellness is in a different
Right.
perspective.
And as you were just talking about the prostate is so interlinked to the consequences of sleep or vice versa.
Yeah. So for all the men above 60, you must check your ultrasound, flowmetry, and PSA regular intervals. And don't worry about surgery. There are multiple options available
Absolutely.
to take care of the symptoms so that you enjoy a good quality.
Absolutely. Thank you for sharing that, Doc. Any final thoughts that you'd like to leave us with? Any points that you think that we haven't actually touched upon, like we were talking about the prostate? That
Well,
you'd
I
like
think
to...
when it comes to urology, everybody talks about stone and prostate, but we often forget one segment, which is the female urology.
Okay, yeah.
The women also suffer from similar symptoms like frequency, urgency,
Right.
difficulty in voiding, but due to entirely different reasons. And they tend to go to gynecologists to help.
Right.
No, we as urologists
Oh, I see.
will
Okay.
be able to help them much better.
Right.
Again, with medications. A commonest problem that the elderly lady would have is incontinence,
Okay, which means what?
which is not able to control urine.
Okay.
So they have wet clothes. So they start using diapers. The situation is such that they are shy to talk about.
Yeah.
And so they keep on suffering.
I see.
No,
Right.
we have wonderful medications to prevent incontinence in women.
And all conservative.
Yes, all conservative, provided they seek help and
Right.
we do minimum investigation.
right,
So
right.
this aspect is often forgotten when it comes to urology. And so thank you for asking me to
Yeah.
cover that. Is a female urology is aspect which can be taken care of very comfortably. Again, what ultimately matters is quality of life.
Yeah, absolutely. Good. Thank you for sharing that also, because I don't think that's something that that I thought about until you mentioned it. So I'm sure that our viewers would appreciate that you bringing that up. And as you said, I think that's a lovely note to
Yeah.
leave this on is that it really comes down to quality of life and how we can do that.
And every individual has a right to have a good quality of
100%.
life.
Yeah, absolutely.
And it starts with well-being, doing good food habits,
Yeah.
hydration, activity.
And people with you in the driver's seat, we can always be rest assured that there's always the right treatment around.
It's been a pleasure being here today. Thank you so much.
Thank you. Thank you so much, Doc, for being here. Thank you all, and please remember to join us for next week's episode. But before you do leave, do not forget to please hit the like and subscribe button here below. And also, if you do have any comments that you'd like to share, any feedback, any topics that you'd like to cover, please do not forget to write down here in the comments as well. Thank you, and see you next week.